Ever wondered how a complex, systemic disease like rheumatoid arthritis gets diagnosed? Well, it's not as simple as just feeling a joint and knowing. It requires a precise and meticulous process involving laboratory tests and clinical evaluations. Today, we delve into the fascinating world of laboratory diagnosis of rheumatoid arthritis. Rheumatoid arthritis, or RA, is an autoimmune disease that primarily affects the joints but can also impact other organs. It's characterized by inflammation, swelling, and pain, and over time can lead to joint damage and disability. But how do healthcare professionals diagnose it? Well, it all begins with a comprehensive medical history and physical examination. However, the definitive diagnosis often relies on specific laboratory tests. First up, we have the rheumatoid factor test, or RF test. This test detects the presence of rheumatoid factor, an antibody found in about 80% of people with rheumatoid arthritis. However, it's not exclusive to RA and can be found in other autoimmune diseases too. Next, we have the anti-citrullinated protein antibody test, or ACPA. This detects antibodies that react against proteins in the body that have been modified by a process called citrullination. This test is more specific for RA than the RF test. A test for C-reactive protein, or CRP, is also often performed. CRP is a protein produced by the liver in response to inflammation. Higher levels of CRP suggest active inflammation, which could be due to rheumatoid arthritis. Erythrocyte sedimentation rate, or ESR, is another test that measures inflammation. It measures how quickly red blood cells settle in a tube. Faster settling indicates more inflammation. Finally, a complete blood count, or CBC, is conducted to check for anemia, which is common in people with rheumatoid arthritis. We should remember, however, that a positive result in these tests does not definitively confirm rheumatoid arthritis. It's a complex disease that often overlaps with other conditions. These tests should always be interpreted in the context of the patient's symptoms and clinical findings. So to summarize, the laboratory diagnosis of rheumatoid arthritis involves several tests: the RF test, the ACPA test, CRP, ESR, and CBC. These tests detect antibodies, measure inflammation, and check for anemia, providing crucial information to healthcare professionals. However, they serve as pieces of a larger puzzle and must be interpreted alongside the patient's symptoms and other clinical findings. Rheumatoid arthritis is a complex disease, but with a thorough laboratory testing process, it can be accurately diagnosed and managed. And as we continue to advance in medical science, we hope for even more precise and efficient methods of diagnosis. For now, understanding these laboratory tests is a key step in understanding rheumatoid arthritis.